So there's a lot in the news about big pharma.
Yeah.
You know, particularly since we've been through the pandemic and a
Yeah.
lot of social media content. And recently there was the Netflix drama about OxyContin.
Yep, OxyContin. Yeah.
At the moment, so this is something that's on the mind of parents. What's the situation in New Zealand? Can doctors get a kickback if they prescribe certain medications?
Not in mental health. I think that would be extremely rare. So we used to have drug reps come to meet with us on some basis, and they would sometimes bring in morning tea or something like that. That practice, I haven't seen that practice for some time now, perhaps 5 or 10 years. And yeah, psychiatry, mental health in New Zealand, most psychiatrists work within the public system, and pharmac's a protective factor because there aren't these new medicines that have a lot of hype and may or may not be better than current treatments, with drug companies wanting to get their use increased. So there's a bit less pressure, I think, because of those things. And then most doctors within the public system, where a good number of these medicines are initiated, have a medical education allowance which is pretty generous. So back in the day, big pharmaceutical companies would sponsor people to go to a conference or pay accommodation, but actually there's not any need for that with public sector doctors. And so, yeah, I don't think there's much sort of risk of that. And if you present at a conference, you have to present your disclosures, what you've done, money you've got out of pharmaceutical companies, and increasingly pharmaceutical companies in New Zealand are reporting on what they're paying out to doctors, which is another safeguard. So I think the risks are relatively low, and we haven't had an opioid difficulty in New Zealand, for instance. I think for many of those reasons.